Hi everyone, my name is Ria, and I chose to do my final project on women's health and just focusing on sexually transmitted diseases. Importance of women's health. Women face a number of unique health problems by virtue of their sex and their place in society. Just being born a female can be very dangerous to one's health, especially in middle and low income countries. And it's very common now that everyone knows that the way a doctor treats a man and a woman is completely different, and these differences are what some of the root problems for why uh, women's health needs to be a very important subject that needs to be talked about. So some of the challenges facing women's health. So, like I said, for women in low and middle income countries, some of the main challenges are connected to reproductive health and violence against women. Women are unequally affected by HIV, AIDS, which is a major cause of illness, disability, and death for women. Some of the biological determinants are deficiency related to menstruation, risks and complications during pregnancy, such as preeclampsia and hemorrhage, which is actually the leading cause of death for maternal death, unsafe abortions, even though it's the 21st century and technology has advanced this much, unsafe abortions are still happening every single day, and women are actually biologically more susceptible to some STIs, including HIV, than men. So one of the journal articles that I found, it stated that current national guidelines recommend that all pregnant women undergo HIV testing as early as possible in the prenatal period. A second test during the third trimester should be considered for all women and is recommended for women with an increased risk of HIV exposure. And I thought this was really important because I heard that some hospitals do not even let the woman give uh, admit them until they show the paperwork that shows that they did HIV testing. And this is to keep both the mother and the baby safe. Um, some of the social determinants are patriarchal societies give women a great disadvantage when comparing health. I'm actually from India, and it's gotten a lot more modernized, but it is mainly a patriarchal society. So even in my own household, my dad believes that he's the head of the household, and we all should follow his um word. And that can be really suppressing for a woman and put her at a disadvantage. Low social statuses of women is linked to physical and sexual abuse of women, often resulting in unprotected intercourse, which leads to HIV and AIDS. Of course, poverty, lack of, or low levels of education also plays a role into how great the impact of this is. So, burden of health conditions. STIs and other HIV are not treated properly. If they're not treated properly, can and may have long lasting effects on health. Pregnant women not tested in time can lead to fetal wastage, stillbirth, low birth weight, eye and lung damage in babies. So, all in all, improving the health of women in the future will require that health systems need to make a change and provide a cost effective package for services including nutrition, family planning, prenatal care, deliveries attended by skilled healthcare providers, emergency transportation for women who are having complicated labors, and care at quality hospital. Thank you so much.